Dear colleagues, I'm Dr. Taner Yılmaz from Hacettepe University Hospital, Ankara, Turkey. I'd like to talk to you about botulinum toxin A in laryngology. When is botulinum toxin or botox indicated in laryngology? In spasmodic dysphonia is the most common indication. Adductor, abductor, and mixed. Contact granuloma, vocal tremor, laryngospasm, or inadequate vocal fold motion disorder. Bilateral vocal fold paralysis, and cricopharyngeal muscle spasm leading to dysphagia need botox injection for therapy. How do we inject botox? It can be injected transorally. It is the most difficult one. It needs perfect patient cooperation, very little gag reflex, no swallowing. Transthyroid through thyroid membrane. Transthyroid, I don't do this, through the cartilage. Transcricothyroid through cricothyroid membrane. It can be intraluminal or extraluminal. For intraluminal one, you insert the needle into the lumen, you need anesthesia. For extraluminal one, needle stays below the mucosa, you don't need anesthesia for this one. For cricopharyngeal muscle, you can use the transcutaneous route for injection. General anesthesia is very rarely needed today for botox injection. But how do we do local and topical anesthesia? There is no need for premedication. There is no need for superior laryngeal nerve block. If you do so, there will be a lot of secretion in the larynx, which will hinder your vision of the laryngeal anatomy. You can apply tetracaine impregnated catenoid to one nostril, through which your flexible scope will pass. You can apply 2 puffs of xylocaine to oropharynx, and you can titrate topical anesthetic 1 cc per 1 minute to the supraglottis, through the working channel of your flexible scope. Just 1 cc is not enough. You have to wait. After 1 cc, you have to wait 1 minute, and another 1 cc, another 1 cc. In between, you have to wait 1 minute for the anesthesia to develop. This is the transoral route. Here, the needle is a little bit too far posteriorly. It should be more anteriorly. It is the most difficult way of injecting botox into the larynx. But for cooperative patients, it may be very easy. There should be very little gag reflex, no swallowing during this procedure. The thyroid route, you have to use double bent needle. This, if you don't do so, you may hit too posterior, which is the case right now. You need to inject into the middle of the passage. And this is cricothyroid, intraluminal one. The needle enters the lumen. You see it from above, and then inject botox to both of folds from below. See, it's contact granuloma. The indication is contact granuloma. And then you do the same thing on the other side. And you need anesthesia for this. I usually use 22 gauge needle, these injections. And this is the extraluminal one. You see the bulge of the needle underneath the mucosa. You should not perforate the mucosa. You see the injection producing a bulge. And I'll do the same thing on the other side. Again, the indication is contact granuloma you see on the left side. You can see the bulge of the needle on the right side and injection material being delivered. This is a patient with laryngospasm during one of her attacks. I will inject her botox transthyrohyoid membrane. This time I hit the middle of the vocal fold. Usually the dosage of the botox is 2.5 to 5 units to each vocal fold. Now the left vocal fold injection. Now I will inject interarytenoid muscles. Another 5 units interarytenoid muscle. I have 2 publications on contact granuloma and botox injection, one in the JAMA in 2013, and the other one in Journal of Voice in 2017. Here's a patient with contact granuloma on the left side. He was operated for 3 times for the same lesion. So don't operate on contact granuloma. It will recur 100% of the time. See, after botox injection is gone, no surgery necessary. Another patient, this patient was operated 4 times with 1 month intervals. Contact granuloma, no surgery necessary, just botox injection. This is after injection, the lesion is gone. Another patient, because of the white color, doctor said, this may be cancer, so we need to take a biopsy. No, this is not cancer, it's contact granuloma. Inject botox, and it's gone. Thank you very much for your attention.